All right, we can start. So endodontics, and you can.
Hello, my name is Dr. David Koilpillai from Montpelier Family Dentistry. Here at Montpelier Family Dentistry, we get a lot of questions about endodontics or root canals. And I will be answering some of those questions today.
Dr. Koilpillai, what is endodontics?
There's a question that may be asked is, what is endodontics? It is actually treating a root canal, which is essentially the nerve inside the tooth, of each tooth has blood vessels and nerves, which sometimes gets inflamed to the point that it doesn't get any better but gets worse. It could get infected, and in that case, uh, the tooth may need a root canal, is what basically we commonly call endodontics. And in which situation we remove the infected or inflamed nerve tissue in the tooth, clean it out, and place a filling all the way into the root where the nerve was.
Okay. Why did my dentist refer me to an endodontist?
You may wonder why your dentist referred you to an endodontist. There are situations where your general dentist may not do root canals, or they may not do root canals on certain teeth. And they may have found that a certain situation they saw on the x-ray or on their examination that said, this particular case is more complicated or more involved, so they would refer you to an endodontist who specializes in that procedure.
What is the difference between an endodontist and a general dentist?
So the question might be asked, what's the difference between an endodontist and general dentist? Of course, a general dentist does a variety of dental procedures, fillings, crowns, root canals, removing teeth, among many other procedures. An endodontist specializes in doing only root canals, and that is all they do. They only see patients that need root canals, and sometimes there are some surgeries associated with root canals that they do as well.
Okay. What procedures are done in endodontics?
So you may wonder what those procedures are that are done in endodontics. The vast majority of the procedures that are done in endodontics is called a root canal, where the nerve is removed from the nerve and blood vessels that are diseased inside the tooth are removed, sterilized, and then filled so that infection can't start again in that tooth. But there are some minor surgical procedures that are also done. One procedure is called an apicoectomy, where there's small surgery that's done at the end of the root, and root canal specialists or endodontists usually do those surgeries.
Okay. Can an endodontist pull a tooth?
So you might wonder if an endodontist can pull a tooth. They can pull a tooth, but they usually do not. They usually stick with their specialty, which is root canals.
How does an endodontist determine if
So you might wonder how an endodontist determines whether you need a root canal. There are several tests. One is X-ray. Of course, it's a diagnostic tool that a dentist or an endodontist uses to determine if you need a root canal. Another might be a test where something cold is placed on the tooth, and the reaction to that cold is recorded. Another might be another instrument that is used. It's called a pulp tester, and also sometimes a 3D CT scan is taken of the tooth also to determine that.
does insurance cover endodontal procedures?
You may wonder if your insurance, dental insurance, covers endodontic procedures. I would say that vast majority of insurance covers endodontic procedures. Each one is different in how they cover it. So you would have to check with your with the dental office to see how they are covered.
I can go ahead and do that.
So I hope I have answered most of your questions about endodontics or root canals. If you have any other questions, please call us at Montpelier Family Dentistry at 301-604-0025. Thank you.